Freedom Healthworks is the direct primary care accelerator. We help doctors across the country start fresh in direct primary care. With Freedom Healthworks, you work with a team, not a checklist. Visit freedomhealthworks.com and together we can achieve true freedom in direct care.
So, gentlemen, let me ask you, what does healthcare entrepreneurship as the antidote to the broken healthcare system actually mean?
Well, of course, we are strong proponents of the free market and how restoring the free market to healthcare, we feel, can be the antidote for most of the problems, if not all the problems, in the current healthcare system. And if you look at how markets work, we also believe that the entrepreneur plays really one of the most key roles in driving the market economy. And the more regulated, the more government controlled an economy becomes, the more entrepreneurship is really crowded out of the picture. So the central role of the entrepreneur is to look into the future and make decisions about what consumers will value in the future. And really they become facilitators of consumer value. And the entrepreneur and the role of the entrepreneur is also where market prices emerge in the free market. So I think what we see is as more government regulation has taken over the healthcare system, entrepreneurs in the true sense of the word have been pushed out of the picture. We've seen doctors that have become more employees of big corporate hospitals. There's not a lot of competition between insurance carriers. So we have a small number of big insurance carriers dominating the industry. We have a small number of pharmacy benefit managers dominating the industry. And those all are results of more cronyism and less entrepreneurship. And so a few months ago, Dr. Smith gave a really great talk, I thought, at the AAPS conference about how physicians need to think like entrepreneurs. And we got the idea that we need to build on that and really talk about how this role of entrepreneurship can go obviously to physicians, but also to the employers, because every employer is playing a role as an entrepreneur in the marketplace. And individuals are also taking control of their healthcare in the free market. So I think that's sort of the mindset where we're coming from. Also, from an entrepreneurship standpoint, a true entrepreneur is looking for opportunity and creating opportunity and making a profit based on making good decisions. Whereas in the crony capitalist marketplace, that opportunity becomes more opportunism. And I think that's what we're really seeing in healthcare today, for the most part, is opportunism versus innovation and opportunity. So with that, I'll let Dr. Smith sort of add to that, or you can take it from there.
Yeah, James, I appreciate that. You covered a lot of ground there, and I just want to make sure we unpack all those different elements. I mean, it's a pretty bold statement. You're dealing with entrepreneurship in healthcare. I love the antidote to the broken healthcare system. And so you laid out a few reasons why the healthcare system is considered broken. Dr. Smith, anything to add to that as far as how did we get here into this broken type of a healthcare system and what that means for doctors, patients?
Yeah, James's answer is excellent. I don't have much to add. I would like to add, though, that physicians are not accustomed to thinking entrepreneurially. Hospitals are allergic to thinking entrepreneurially. This whole idea of surprise medical billing that has gripped media, all of that is so anti-entrepreneurial. The entrepreneur's job is to, as James said, look into the future and basically say, here is something that can be done, something that's new, and here is a price that's attached to it to really expose their value and their capital to the public for either an indictment or endorsement. And when hospitals say we don't know how much the surgery costs until after the surgery is over, that's an example of anti-entrepreneurialism, and I've seen that in a lot of physician colleagues. They really are having a hard time wrapping their mind around, how do I say, here is what I do and here's how much it is, and let the market judge me. I think one of the goals for this conference for the physicians and for the facility owners and managers is to embrace this uncertainty. Last year, our theme was "Burn Your Ships," and this is a great follow-on. After you burn your ships, then rather than be fearful of the uncertainty that's in front of you, truly look at it, as James said, as an opportunity. I think also it will give some insight to the business owners and self-funded plan owners and managers in the room in a vindicating way, the extent to which they have been entrepreneurial. And I think it will be good for the physicians to visit with true entrepreneurs. One of the conversations we continue to have is the old chicken and egg. Does the the free market surgery center or hospital appear and then hope that the buyers show up? If we build it, will they come? The other side is, is there a way to actually identify, is there a demand for fairly priced, non-price gouging services? And the people who can solve that and reduce the amount of uncertainty that exists are all going to be in the room. And so, really, you mean you would buy from me if I didn't rip you off? All of those players are going to be in the room. And I think we also will place the facilitators, the middlemen who are necessary and who do bring value in a much more clear light with our theme of entrepreneurialism, because those middlemen that actually bring the buyers and sellers together in a meaningful way and add value, I think will be seen in a better light, in a much more clear light. And those were the ideas I had in my head when we picked this theme.
Mm-hmm. So you touched upon the Free Market Medical Association annual conference is coming up soon. It's at the end of April. And I love the theme last year, the burn the ships mentality, because that is it just has this visual of, hey, we're all in. There's no retreat from this. How was it received last year? How was that theme received? And why the theme this year? It's a little less bombastic. It really is. Any feedback from the Burn the Ships days all the way to what we're looking at today? I mean, has the movement come that far where we don't need to have the burn the ship mentality, or do we still need that type of mentality?
I think that if you read if you read about entrepreneurialism and you study it, if anything, this year's theme is much more radical than burn the ships. There is been a long debate about even defining entrepreneurship and entrepreneurialism. Ludwig von Mises said every man and woman alive is an entrepreneur because they act in the face of uncertainty. And that is how he ultimately defined an entrepreneur. So if you study entrepreneurship and you realize that there is this studied embrace of uncertainty with a plan of action, that is a very sophisticated, elegant, but I would suggest even more radical manifestation and extension of burn the ships. Mm-hmm. Burn the ships was a bit of a risk as a theme because it was so radical, but the end result was exactly like it's been at the end of every FMMA meeting, where everyone walked out inspired and ready to take on risk and be more bold. I think this year, with the cast of characters that are speaking, these are the world experts on entrepreneurship that are going to be speaking at this meeting. I think people will have a very sophisticated understanding of what does it really mean to burn your ships. What does it mean to embrace and understand and quantify risk? So I think I think when people leave this meeting, they'll be inspired, but they will also realize they've heard maybe an even more bombastic and radical message than what they heard last year.
Interesting take on it. Interesting take on it. Dr. Smith, wanted to follow up with something you said a little earlier about a lot of physicians, in your opinion, don't have the entrepreneurial kind of mindset. Is that something that is learned, or is that something that's a personality trait in today's physicians?
You know, there are multiple aspects to it. My theory is that it's basically a psychological problem, but it's also downstream of the training that we receive, and I believe that physicians many times apply the risk aversity that is so appropriate in the clinical management of patients to the business side of the practice. I think also that physicians are surrounded with teams of people who constantly tell them, focus on the medicine, we'll take care of the money part. So, you talk to the average physician and you start talking about these things and say, oh no, I hire people to worry about the money part.
And they have no idea.
Yeah, they really don't know. And what they really don't understand is they are abandoning their patients with that stance, because no one, I don't think anyone can be a financial advocate for patients any better than the one who is also their medical advocate. And so it's a cop-out, I think, for physicians to, I just have somebody else take care of all the money. I don't worry about that. And it's done a real disservice, I think, to patients, and the industry has become just a beast that looks very much like something that's managed by people who, by and large, could care less about patients, and it is completely
Right.
the fault of subsidies and other insanity that's inflicted on a spinal cord.
It's a pretty complex payment system when you start to peel away the layers. James, want to ask you, with what we're kind of talking about, this theme of entrepreneurship in healthcare, with your work with the FMMA and then planning this conference and getting the slate of speakers up and going, was it tough to find the entrepreneurs in that new way of thinking within the current healthcare industry as you were planning this?
Well, I think a lot of the people that are part of the FMMA are already entrepreneurial thinkers, and that's why they're part of our movement. So, no, I don't think it was very difficult to get a number of great speakers. And as Dr. Smith mentioned, we have really good contact with Peter Klein from Baylor University and Per Byland from Oklahoma State, who are highly prolific economic minds who write for Entrepreneur Magazine. They speak to a lot of companies. So they are going to be able to take a lot of the ideas of how the economics of entrepreneurship can be applied maybe more clearly within the medical sphere. But the people that are part of the Free Market Medical Association, especially as Dr. Smith said, a lot of the very valuable facilitators and middlemen out there are doing great work, and we have a number of them coming. We have very entrepreneurial minded brokers that will be there, the entrepreneurial CEOs, the entrepreneurial minded CEOs when it comes to healthcare will be there talking about how they have really taken this mindset to lower their health costs for their employees. So I think we have a really good group of people coming to the event.
Yeah, and before I ask about who's speaking and kind of the lineup and ask you guys to give us a little bit more detail of what the conference and what the weekend looks like, I just want to point out the fact what you said there, that so many times, especially in the direct primary care world where Freedom Healthworks operates, a lot of times we kind of get a sideways glance like, oh, who are you guys? Are you guys trying to get into doctors' pockets here? And so it's refreshing to know that once this new kind of cohort of physicians are looking at this, people understand that, hey, it's okay to ask for help, and that there are a lot of companies and people out there who are interested in doing the right thing for physicians. So appreciate you guys bringing all parties who are invested in this movement together. Doctors obviously are going to be leading the charge here, but it's okay to ask for help at times. So James, give us a rundown of what kind of speakers you have and what people can really expect by tuning in and attending the conference.
Yeah, so as we have done in the past, we have a number of keynote speakers that will be there. The first one is Dr. Larry Van Horn from Vanderbilt University. He was really the primary architect of the executive order that was signed by Donald Trump last year. He's a strong advocate for cash markets and returning cash buyers to the healthcare system as a way to lower cost. He'll be there speaking. We have, as I said, I think we have about 3 or 4 CEOs that will be there that we're going to have you interview and basically do a live audience version of Healthcare Americana podcast.
I can't wait. I'm pumped. I'm excited to do that.
So
gonna be asking the tough questions.
talk to some of those CEOs about their experience in working with facilities like the Surgery Center of Oklahoma and others out there. Will be very informative. And then we'll have breakout sessions as well that will be geared more specifically toward employers, some for employers, some for surgeons and DPC doctors, to go into a little bit more detail about how some of their colleagues have been successful. One story in particular I'm really excited about is that we have a member called Sona Pharmacy from North Carolina, and this is basically a pharmacy that got fed up with the whole process of dealing with third-party administrators that were not free market friendly and pharmacy benefit managers. So they basically decided to start their own pharmacy benefit management company. So doing some very entrepreneurial things. We'll also have a panel of some providers that are doing things that people have traditionally said could not be done by the free market, like ER services and transplants. Accurate Health that does bundled cash pricing for major transplant procedures. The Oklahoma Proton Therapy here that are also working with self-insured employers to offer cash services for cancer treatment. So I think there's just a lot of great things that are happening, and those are just a few of the things Dr. Smith could add to that. But of course, you know, a lot of people come to hear from Dr. Smith and Jay Kempton, the founders of the FMMA, and sort of have an opportunity to pick their brain and ask them questions is always a great thing for people to come to our conference to hear.
Yeah, absolutely. Dr. Smith, so who should be attending this conference? Is this just physicians? Is this anybody who's interested, people just finding out, people who already know about this?
I think this is a useful meeting for all different kinds of people. It might surprise you for me to say the person that probably would benefit the least from this meeting, although many of them are there, are the doctors. The real beneficiaries of this meeting truly are the idea people, the third-party administrators, the self-funded employers, and the people who manage those plans, and the people who are in charge of or manage a facility that would like to actually quit price gouging patients. Many times the physicians who do attend are physicians who either own or control a facility that's interested in entering the space. There would be a lot of direct primary care doctors there. There always are.
Right.
They tend to be very entrepreneurial and open-minded to all these ideas. And it's been a great resource for them as well as the facility managers. We continue to receive many referrals from direct primary care doctors from all over the country, and many times because they've attended this conference. So I just want to I want to stress that, I mean, there would be think tanks there. There would be stop loss carriers, ERISA lawyers. This is an industry meeting, and the physicians. I encourage physicians to come because it's helpful to understand the language of the industry in order to change it. And lately, I've become really intrigued with Marty McCary's characterization of the self-funded industry as the most powerful proxy buyer. So, an individual patient says, I don't know how much my tonsillectomy should be. Well, there are giant self-funded companies that are out there shopping for tonsillectomies and basically creating a market and serving ultimately as proxy buyers that individual patients then will be able to rely on. So it's going to be a very very interesting meeting. And again, it's radical. I mean, there are people who are still scratching their head trying to figure out how does the free market apply to this industry. And here we are having a meeting talking, taking a real deep dive in how to apply the principles of entrepreneurship to this. Right. So we've gone way beyond where we started with these ideas for sure.
Right. James mentioned something really intriguing, and we love to see that too, because when we look at this and we talk to people, they always want to pick it apart saying, well, what if I'm in a car wreck and I get taken to a hospital? I don't have any discretion about that. But with cash ERs, I mean, that plugs a major gap in really building kind of this an alternative to an insurance-based care system. So in your guys' opinions, are all of the necessary components to build an alternate to our health insurance system, are all these people going to be there in one room together?
Yeah, there would be a lot of them there. There was a fascinating Twitter exchange that one of our speakers, Per Byland, economist and expert on entrepreneurialism at Oklahoma State University, was involved with. Someone was actually criticizing the free market movement because it was immature and faulting the incompleteness of the coverage of all modalities of care. And Dr. Byland made it very clear that this person was basically criticizing the immature developing free market because it was immature. Yeah. And of course, with time, that argument withers because every day, just as James said, someone else joins, whether it's emergency care, proton therapy, bone marrow biopsies, complicated cancer surgeries that are going to be available through a Current Health. And so the wagons continue to circle this idea. So the folks who are the naysayers shouting, yeah, but what about this thing? What about this? And again, their arguments are relevant because it doesn't matter to the patient that we operate on for hernia repair if we don't do dialysis at Surgery Center of Oklahoma. They could care less. All they care about is that we are providing a service for them to fix their hernia. Mm-hmm. But the good news is this movement is rapidly becoming all-encompassing. And I agree with Dr. Byland. I think it's a cheap shot to criticize this movement for not being all-encompassing, because that is a character of a fully developed, mature market, and this one's still developing.
Well, it's like, how is that person even defining a mature market? I mean, that is just you're tossing it into the wind and saying, oh, I'm trying to find an excuse for something, anything, to try to belittle what these people are doing here. Some people, I don't know, maybe they just don't get it. Maybe they're happy with the broken system, as we covered earlier in the show here. Dr. Smith, you mentioned something that was really, really interesting to me. And James, you mentioned Jay Kempton's name, co-founder of the FMMA, and he was on a previous podcast episode to kick off our season here. Kind of told us a story about when he started sending clients to the Surgery Center of Oklahoma and his phone started ringing off the hook saying, hey, why are these people leaving? And what the heck is the Surgery Center of Oklahoma doing that's so different? And I started laughing and smiling when you mentioned that there are facilities who, in my opinion, have seen the light and are coming to this conference and are coming to engage your organization saying, hey, is this something that we can do too? Are we just beholden to these complex prices? And how do we get into a pricing model and a cost model associated with it that is more friendly to this type of a movement? I mean, that to me is just absolutely incredible.
Yeah, and it's some of these people come for the right reasons because they're tired of being an accessory to a crime. And some of them are coming because they've had their pocket picked by another FMMA member who is actually honest with the pricing, and a patient has left them and gone to my facility or another.
Mm-hmm.
I also want to point out there are a lot of people that are participating in this movement that remain behind the curtain. They are not showing themselves, but they are participating. They are providing pricing. And there are a lot of hospitals that are matching my pricing, for instance, just to keep the patient from traveling to Oklahoma City and coming back and telling their friends how wonderful it was. So there are a lot of closet supporters of this movement, and there are a lot of people that the market is dragging along, kicking and screaming, that will not be at this meeting.
Mm-hmm.
So this movement is much more gigantic, I think, than we could actually quantify, because there are so many people in the shadows that are every day trying to figure out how to deal with it.
Right. Well, it's international too, right?
Oh, yeah.
It's
James?
Well, I was going to say, I think there are also a number of surgery centers and places out there that I'm getting contacted by on a regular basis, and I know they talk to Dr. Smith too, is they're seeing, because the individual's family deductibles have increased so much, it's become pretty apparent that a lot of individuals are not having surgeries or procedures that they could be having. So there's really an opportunity out there to reach out to those people if they can offer a competitive price. So that's just the market at work, because of the way the system has driven people to basically postpone care that they could be having. So
right.
There's a marketing opportunity there. There's an opportunity to create value that will attract those people into your facility.
Yeah, and you brought up the cost of insurance plans for families. What we just surpassed $20,000 for a family of four, for an average price of a health insurance policy. And some of that, people argue, well, that 2/3 of that's covered by an employer. Somebody's going to be paying that money somewhere. And then you bring in a theme we like to talk about, being functionally uninsured, right? Well, you can't even afford your deductible in the first place. So why even have a policy? But to know that there's options and there's organizations such as yours that are trying to stem the wave of that and turn it the other way. So shifting back to a little bit more about the upcoming conference from the FMMA, give us a little bit of detail, James, of dates, locations, and then how people can learn more.
Yeah, the conference is going to be in the Dallas area, April 30th through May 2nd. And they can go to our website, fmma.org, and see all the details about the conference. The schedule is there. Vendors who might like to be sponsors can help sponsor. I think we've done some outreach to offer opportunities for people to give scholarship dollars for medical students. I don't think we've really touched on that, but I think in your last podcast, you were talking to the director of the Benjamin Rush Institute. They're a very good partner of ours, and they have chapters all over the country. So traditionally, they've helped us to reach out to medical students to bring them to our conference. So we would love people to come and donate to that, even if they can't come to the conference. Help a medical student come and learn about these ideas.
And I'm glad you brought that up. It was my next question to ask you guys, but you beat me to the punch there, James. So what could a medical student come to this conference? What's that experience like for them?
Well, it's the individual in the room that probably needs the antidote worse than anyone else that would be in the room. Medical students and residents in particular, are exposed to all the insanity of socialized medicine, population health, all the other collectivist schemes that are meant to disenfranchise the individual patient and get young physicians thinking in terms of group or herd management. And it's a disaster. It's an ethical disaster. It is a necessary step, though, in the indoctrination of young physicians, so that they will, do what their employer says rather than act in the best interest of the patient. So
Right.
This is a meeting where these are radical individualists that are in the room. These are radical advocates for patients, and these are unapologetic defenders of property rights and capitalism.
Mm-hmm.
And we see the free market as the best way to achieve access for them, the greatest number of people at the best value, and also simultaneously the best quality of care.
Right.
And that is not the message that medical students and residents are receiving in training. And so, our theme, an antidote, entrepreneurialism being the antidote to what ails us, the medical students really need to hear that. I did a Skype interview with a group from Colorado last night, and it's a business group, and they were so moved that they basically sat down with their checkbooks and were sending money in. James, you're going to see that come in here pretty soon. And, our goal is to get 25 medical students there, and it costs about $700 a piece, just our cost to have them there. It's a very reachable goal. I think on the website, FMMA, there's actually a running tally that shows you how successful we are in achieving that goal. And I would encourage the members of the FMMA to be generous in this effort because there are people who are not members of FMMA all over the country that are starting to send these funds in. And I would like to see the members step up too, and let's get 25 medical students there, and then next year be more bold. And I would like to see, as Marty McCary suggested to me last year, half of the attendees being medical students and residents next year, and that really is that's a reachable goal, and that really is that's kind of on my list of to-dos for next year.
It's a very noble goal. So there it is, the call to all current and potential FMMA members. Help send some medical students to the conference this year and help them fight that indoctrination, Dr. Smith, as you put it there. So it's really cool to see that even the outreach groups capturing those young physicians before they even get disillusioned with their careers, that is happening, and showing them that there is a totally different way to do things that is growing pretty rapidly, I would say there. Gentlemen, anything else you want to tell us about the conference coming up, or the efforts of the FMMA in general going forward?
I think we both have a lot of optimism about where we're going, where this movement is heading, as an antidote to the national narrative that the government needs to do something to fix healthcare. The government has done enough to ruin healthcare for many, many years. And so, some of the latest propaganda out there it's a little, can be confusing for people because they use a lot of the same things that we identify as problems with the healthcare system: high administrative costs, too many middlemen in the process. And so the answer that a lot of people are saying is, well, we can eliminate all of the administrative costs if we just have a single payer and eliminate all this complexity. But the reality is the market deals with complexity in every other industry. Complexity is all over the place. So that's not the issue. It's not the problem of multi-payers. It's, we need to focus on what the market does for every other industry. And I think that's what our members are doing.
Healthy competition, right?
Yeah.
Absolutely. Well, gentlemen, I want to move into what we call our Healthcare Americana crystal ball segment. So we're going to ask you what's next in healthcare from your perspective. James gave us a little bit of preview there from an FMMA standpoint. So Dr. Smith, this was going to go to you. So gaze into your crystal ball. Where do we go as an industry? And then where does your organization go from here?
I'm very optimistic. I think the industry is going to go the correct way. I think it may get a little worse before it gets better. But this idea of cheaper and better is becoming much more difficult to argue with. It's always been difficult. Even in the old days, 11 years ago, when we put our prices online, it was very difficult for the naysayers to make an argument that was effective at all against cheaper and better. And we now have this vibrant movement that is all over the country. I don't know how many state chapters of the FMMA, it's over 30. And the idea of cheaper and better is out there. The idea that this is something that cannot be done is an idea that's way behind us. Now there are all of these varied ideas on how to accomplish and what we're doing and how to get over the finish line. So the argument has changed and the discussion has changed from a matter of whether this can be done to the various methods to achieve that success. So I'm very optimistic. I believe that this is a year because we are at a tipping point where we will see major hospital systems approach the Free Market Medical Association and basically ask for the members' assistance on how can they join us. I think this may actually be the year where we see a defection of a major insurance carrier where they actually are approaching members, trying to get involved in this. If for no other reason than they're concerned about losing clients because the movement has gained such credibility. So the power and the beauty of the market is on display, and will truly be on display in what I think will be an astonishing meeting in Dallas, a real jaw dropper for anyone who's interested in attending.
Very nice, very nice. Well, gentlemen, thank you so much. And just to recap, that's the Free Market Medical Association Annual Conference coming up April 30th through May 2nd, Dallas, Texas. For more information, visit fmma.org. Gentlemen, thank you both for tuning in and joining us on Healthcare Americana.
Thanks for having us.
Thanks so much.
Wish you the best of luck. Healthcare Americana is powered by Freedom Healthworks, editing provided by Taylor Scott and iPodcast Pro. I'm Christopher Habig. Thanks for listening. Hi again, everyone. This is Chris. At Healthcare Americana, we're always on the lookout for great stories to tell in the healthcare industry. And we'd like to hear yours. Check out healthcareamericana.com and send us your ideas for episodes or if you'd like to be a guest. Thanks again for listening. Hope you enjoy it.